Hi guys, I am at Innovations Medical with Dr. J doing some off-air chat about resurfacing and our skin. Now these segments get a lot of attention when we talk about them on air, so let's remind GMT viewers exactly what resurfacing does and why we should consider it.
Well, resurfacing is appropriately named, Amy, because what we're really doing is putting a new surface on the skin. Now, if you go back 10 to 15 years, that was done as complete resurfacing, which is really a pretty brutal procedure.
Aggressive,
They
right?
would take off the entire surface of your skin, and it would take months for it to completely recover.
Yikes.
About 7 or 8 years ago, a new technique called fractional resurfacing was developed.
Okay.
And with fractional resurfacing, we can demonstrate real well what we're doing. If this were the surface of the face, then what we're doing, instead of taking off the whole surface, we're taking off hundreds or thousands of little areas, so that with all these little areas are resurfaced, it stimulates the skin to heal almost as completely as it did with resurfacing before. But now, because so much of the surface has been left, instead of having 6 months of red face,
Right.
You've got 6 or 7 days of red face. Instead of having a month of swelling, you've got a day or two of swelling.
That's fantastic.
So it's a much more widely used technique now. We can do it much more frequently than we used to do it. And so fractional resurfacing has really become the standard.
Okay, and this is really for all age ranges. Do even younger persons do it because of maintenance?
Well, not only that, so with younger patients, we see a lot of pigment issues like melasma.
Right.
Some people don't like freckles. Now, freckles can be even more resistant even to resurfacing. But if you want to fade them, if you want to make them look better, resurfacing is the way to go.
Okay.
So a lot of young people like it for that. And then what you mentioned, a lot of people like to do resurfacing as a maintenance. I like the way my skin looks. I like how tight things are when you're 20.
Right.
Yeah, don't we all wish? And it is a good way, and research is showing more and more that that's a very good way to keep that firm and radiant look that so many of us have in our 20s and don't have when we get into our 40s and 50s and later.
All right, let's bring this board up. I want to demonstrate exactly what we're talking about when we say resurfacing. Sometimes it's nice to have a visual to go along with what you're talking about. So these are some common problems that we have: pigment issues and wrinkles.
So these are two identical faces that we've drawn here on the board. And with one, we've done some pigment issues. Now, melasma is the pigment of pregnancy that women get when they have the hormonal change associated with pregnancy.
I had that.
Some women get it from just being on the birth control pill or other
Right.
hormonal issues. And it's a very difficult to manage disorder, and it's also an order that tends to come back even if you get it under control. When we do resurfacing, it's very much like using the eraser. It will erase with a few treatments, just like I have to go back over it with the eraser. I typically have to do 3 or 4 treatments with melasma to get it gone. It's the best treatment out there for melasma, though, because it'll fade it and keep it faded for several months to a year or two.
Okay.
But melasma is a chronic condition. That's been one thing that's really changed in the thoughts of management over the last 5 years. So most of these patients that are doing melasma need to remember they're going to probably have to come back in a year or so and do 1 or 2 treatments to keep it where they want it.
Okay.
On this side of the face, we've drawn some age spots. Age spots are the same way. With 2 or 3 treatments, we can get rid of the age spots very nicely.
Okay.
Age spots don't come back, but here's the thing to remember. The damage that we did that caused the age spots
Right.
affected our whole face, and we did it years ago. So we're probably going to develop new ones if you give us a couple of more years.
Right.
So again, the thing about fractional, people ask all the time, is this permanent? The answer is yes, in that it does what it does, that treatment, but it's not going to get rid of all the aging effects you had before,
Okay.
and it's not going to stop future aging.
Okay.
Okay? So, but we can really make a big difference on pigment.
But it's going to make you look a lot better.
It makes you look a lot better.
Obviously.
Now, this is a face we've aged. And one of the great things about the resurfacing lasers, especially the more heavy duty ones like the carbon dioxide laser,
Right.
is they're really, really good at removing fine lines and wrinkles. So when we do it around the eyes or around the lips where there's a big place, around the eyes, Botox is great. It really helps with the crow's feet, and we really like it. Adding the carbon dioxide laser gives further help there.
Okay.
But around the mouth, most people won't use Botox.
No.
I agree with that. It can cause some real problems with your smile, with drooling.
Right.
So around the lips, the carbon dioxide laser, really a great way to go. When you combine it with a little volume, like from Restylane or your own fat,
Yeah.
you can make some tremendous difference on what the lips look like.
I need some of that. That sounds
And
good
then
for me.
on the forehead and on the brow, we use Botox up here too, but folks, as we get into our 50s and 60s like me,
Not like me.
we get real creases that are there even when our faces are at rest. And those creases can really be made better with a resurfacing laser. So we can both help with the pigment and help a large amount with the fine lines, wrinkles, and general tightening, all with the resurfacing lasers.
Okay, so a lot of times there's many different lasers. It really just depends on what your issues are. If it's pigment, if it's wrinkles, if it's a light case, or if you're a heavier case. And I'm guessing with heavier cases, some other treatments kind of go hand in hand with these resurfacing lasers.
Resurfacing lasers are a great tool. They're not the only tool. It's exactly what you're talking about. Sometimes people really need more general tightening and lifting.
Right.
And if we're going to do that non-surgically, Thermage, which uses radio frequency energy to heat much deeper than these lasers go and give a much deeper tightening, Thermage is a great combination with these lasers because they work at different levels and they do different things. The other thing that's real important for a lot of us as we age, we also lose volume. We lose volume around our lips. You know, we look at ourselves when we're 20 and we have these nice, full, plump lips, and we look at ourselves when we're 50 and we have these thin lines.
Right.
Okay, and putting volume back in, either in the form of a volume agent like Restylane or in the form of your own fat, which is more permanent and ultimately cheaper. Those are great combinations with the resurfacing lasers.
Okay, so the bottom line is you have to come in for that consultation because there's so many different varieties of treatments, and we're going to customize one that's right for you.
That's right. We start with the CO2 laser, which is a very intense laser with several days of downtime. We do a lot of Fractional Restore, which is a less intense laser that really can still do a lot, and it's my favorite for the pigment. Doesn't do quite as well with the fine lines and wrinkles or the tightening, but it has basically an overnight downtime. So you come in, have it done, you can go back to work the next day.
Well, a lot of people like that option.
And then there's the Clear and Brilliant laser, which is great for younger people, great for folks that are doing maintenance. They've done the full resurfacing and now they want to maintain it.
Right.
Clear and Brilliant's great because you can come in, have it done, and go right back to work.
Yeah.
So different levels for different needs, and it's important to know where you fit in and how each one can go together to give you the results you're looking for.
Yeah, based on your time, what your case is, your budget, all of those good things. So come on in, talk to Dr. Johnson. He's a nice guy, not scary at all, right? So it's really fun to stop by today. Thank you for helping us understand resurfacing.
Thank you, Amy.